Hello friends, welcome to my channel. Today's topic is thyroid hormone, its disorder and the treatment. This is the second video on this topic. Let's quickly revise what I finished in the first video. So in the first video, I told about the anatomy of the thyroid gland below the larynx and in front of the trachea it is present. And this is the structural unit of thyroid gland, that is a thyroid follicle, and it is a all the epithelial cells, they are arranged in a sphere. So this is a thyroid follicle. Then this single cell, this is the follicular cell, and this cell, it is going to synthesize T3 and T4, and in between the follicles on the lateral side there are parafollicular cell, they are there, which is going to secrete the calcitonin. So from the thyroid gland, three hormones they come, two from the thyroid follicle and one from the parafollicular cell. So from the thyroid follicle, it is T4 or tetraiodothyronine and triiodothyronine, that is T3. And from the C cell or parafollicular cell, this is a calcitonin, which mainly maintains the calcium balance. Because T3 and T4, they resembles their biological activity, they are same. So under the thyroid hormone, we are going to consider only these two. In the next step, I told how it is synthesis of this thyroid hormone takes place in a follicular cell. So this is a single cell I have focused, the single epithelial cell I have focused. This side it is a luminal site and this side it is a basal side. And the basal side there is a blood vessel. This is a blood vessel. So first step, there is a iodide which is taken from the diet. Uptake will be there in the iodide form with the help of sodium iodide symporter pump. Then this is transferred, or this is actively transported towards the luminal side with the help of another transporter, that is a pendrine. Then this iodide with the help of thyroid peroxidase enzyme, which is present on this luminal side पे यही होता, with the help of this enzyme it undergoes oxidation. So iodine that is converted into iodide ion. ये आपका जो iodide है ये आपका iodine में हो जाएगा convert. Then this iodine, it is inorganic, so organification of this iodine it happens. So how organification will happen? It is going to bind with the tyrosine, amino acid tyrosine. Now from where the tyrosine will come? So tyrosine, is it a structural unit of this TG here? TG, this is a thyroglobulin. It is a structural unit of tyrosine. So thyroglobulin, it consists of many amino acid, and in that one amino acid, that is a tyrosine, like a tire I have made here. And organification, how it will happen? If with the tyrosine one iodine, अगर एक iodine लगती है, then it is going to form monoiodotyrosine. अगर दो iodine लगती है, then it is going to form the diiodotyrosine. So MIT and DIT. So if one MIT and two DIT, they are going to combine together, then the synthesis of triiodothyronine or T3 will happen. And if two diiodothyronine and diiodothyronine, if their coupling happens, then this is T4, it is synthesis. So next step is coupling. उसके बाद आपकी होती है coupling. Then whenever body needs this T3 and T4, then what will happen? The endocytosis, ये आपका अंदर चला जाएगा, because T3, T4 and DIT, all they are attached with this thyroglobulins. They are although they are structural units. So T3 भी है इसके साथ, यहाँ पे भी है DIT, MIT, all. Then what will happen? This lysosomal enzyme, they are going to break down this, and they are going to release this T3 and T4 in the circulation, and this MIT and DIT, it will be iodine, it will be again reutilized. And what will happen in the periphery like liver and kidney? This T4, it is a major hormone, and T3 it is a minor hormone. But in the but T3 it is an active hormone. So what will happen? This T4 it is converted into, sorry, here I have written T4 is converted into T3 active form. In the liver and kidney, it will be converted with the help of deiodinase. Right? Now once it is released, now how this it is going to act? ये क्या करेगा? उसके बाद क्या काम करेगा? So all these step: iodide uptake, oxidation, then iodination, coupling, storage, and whenever it is released, then there will be peripheral conversion. So what, once it is released, then what will happen? So it is bound to plasma protein. सो थायराइड किसके साथ बाउंड होता है? प्लाज्मा प्रोटीन. कौन से प्लाज्मा प्रोटीन? इट मे बाउंड विद द थायराइड बाइंडिंग ग्लोब्यूलिन, थायराइड बाइंडिंग प्री एल्ब्यूमिन or albumin, but it is a free form of the thyroid hormone which is active and which is going to perform all the action. जितने भी आपके metabolic action है वो सारे that will be with the free hormone, not with the bound form. So this is a free hormone which is going to bind with the receptor and going to exert all its action. So once the action is over, then how it is this is metabolized. This is metabolized with the conjugation. Conjugation किसके साथ होगी इसकी? Glucuronide, then sulfate, even with the deiodonated it will be. So this conjugated one, and main metabolism happen in the liver. Now this conjugated will be excreted in the bile. ये कहाँ जाएगा? It will be excreted in the bile, then again deconjugated in the intestine. What is this process is called? And again reabsorbed. So this undergo enterohepatic circulation, right? So half-life of T3 it is less, 1 to 2 days or 2 to 3 days, and T4 it is 4 to 7 days. So it is a longer acting and more sustained action. So once it is now what is the mechanism of action of this thyroid hormone, whether T3 or T4? Let's see in the next figure. So this is I have taken from the Triparty standard textbook of pharmacology. Here you can see this T3 and T4 both. Firstly, they will be actively transported within the cell. Now, what kind of receptor this thyroid receptor? किस तरह के? They are the intracellular receptor. Cell के अंदर है, तभी वो cell के अंदर. And cell के अंदर भी they are the intranucleus. Within the nucleus, ये पूरा का पूरा cell है, and this is the nucleus. ये nucleus बना. You can see here the nucleus. ठीक है? Now, this T3 and T4 both they will enter with the active transport. Then within the cell, what will happen? This T4, it will be converted with the help of 5-deiodinase to T3. Now this T3, it is going to bind with the receptor. Now as such receptor, how it is present in the nucleus? As such this receptor, it is in inactive form. ये inactive form है. It is bound with the thyroid responsive element, and along with that the co-repressor that is attached with the thyroid receptor. So transcription that is repressed. Now what happens? Once the T3 it enters within the cell, once it binds with the side, receptor side, then this receptor it heterodimerizes. Heterodimerizes क्या है? ये है आपका thyroid इधर TR. Now what happens in this figure? What difference you find? Here it is thyroid receptor and here it is a retinoid receptor. So it is going to make a dimerization with this retinoid receptor. So heterodimerization will happen. Once this will happen, then what will happen? The conformational change will happen in this. Then this co-repressor that is replaced by the co-activator, and this receptor it gets activated. ये आपका activated हो जाएगा. What will happen? The transcription will happen with the messenger RNA, and protein will be, specific type of protein will be synthesized, and which is going to exert various metabolic effect. This is how this thyroid hormone it is going to act with the help of thyroid receptor. And there are few action of the thyroid which happens because of the activation of or sensitization of the catecholamines. So it increases the sensitivity of the beta receptor with the catecholamines. So जैसे आपका increase heart rate, that increase in the blood pressure, tremor will be there, arrhythmia, all that action they exerted through the activation of the beta receptor with the, or the sensitivity of the beta receptor with the catecholamines. Okay, other action of the thyroid or T3 or T4, that is on the cell membrane. It is going to exert, and there will be increased uptake of the amino acid and glucose, the entry that will enhance. So this is various sites where the T3 and T4, they can act. On these receptors, they are present almost in all the cell of the body. Now, what action it is going to produce? The most important action of the thyroid hormone is a growth. Now, which growth? It is both physical as well as a mental growth. So, with the deficiency of the thyroid hormone, what will happen? The mental growth, mental retardation will happen. So, nervous system यहाँ पे दिया, mental retardation will happen. So all the milestones, they are delayed if there is a hypothyroidism. So अगर होता है बच्चों में हो जाता है, like in the children and in infants, if there is hypothyroidism during the pregnancy, that leads to cretinism. So mental retardation, that is a feature of this cretinism. So this requires for both physical and mental growth. Then metabolism of all. Second one is a metabolism. Metabolism आपकी कोई भी, जैसे carbohydrate metabolism, lipid metabolism क्या है? Depending on the need, it causes a lipogenesis, it's called a lipolysis. Same way it causes glycogenolysis, gluconeogenesis, and in protein also it is going to cause a negative protein balance. Then another important, caloriogenesis. This is the one which is going to increase the BMR. This is very very important. Okay, basal metabolic rate, it is going to increase the metabolism of the body, so it is going to maintain the temperature. Then CVS में direct action भी है, indirect action भी है, ठीक है, and through beta receptor the action is also there. It causes the increase in pulse rate, hypodynamic circulation हो जाएगा, increase in the pulse rate, and even beta receptor की मैंने बताया beta receptor sensitivity, that is also increased. So pulse is increased, hypodynamic circulation हो जाएगा with the thyroid hormone. Then it can also cause the various type of arrhythmia also. Nervous system already I have told. And if there is a hypothyroidism, then it is going to cause the mental retardation. Agar hyper hai, the person will be anxious, tremors will be there, okay, all that. Then skeletal muscle, इसमें भी है, this is required. Agar if there is a deficiency, the muscle will be very flabby, no tone will be there, and if it is more, muscle will be very much tone of the muscle will be increased. Same way GIT में hypo will cause constipation and hyper are going to cause the diarrhea. Then hemopoiesis, they say the deficiency of thyroid hormone leads to anemia. That means this also facilitate, nobody knows the reason, erythropoiesis. Then reproduction, many female infertile patients, and they say the thyroid hormone, they are necessary for the pregnancy and lactation. So many times because of the deficiency of thyroid hormone, that leads to infertility, that leads to oligomenorrhea. Now thyroid disorder, the main thyroid disorder, the hormonal deficiency leads to hypothyroidism, यहाँ पे पता लग रहा है, and increase leads to hyperthyroidism. So hypothyroidism में आपके manifestation in infants and children, cretinism, and adult hypothyroidism, that is myxedema. Then there is a goiter, and one more, that is a myxedema coma. Okay. So cretinism, this is seen in infants and children. So it is of two types, sporadic and endemic. Sporadic if there is any defect in the synthesis of the hormone. Endemic if there is any iodine deficiency. Even during the pregnancy, if there is iodine deficiency, that leads to cretinism. And one of the important feature of cretinism is mental retardation. So आपको जैसे ही पता चलता है, immediately if you come to know about this cretinism, so immediately put the patient on thyroxine. ठीक है. Then myxedema. Myxedema में क्या है? Edema will be there because of the deposition of mucopolysaccharide. So edema. This is an adult hypothyroidism. इसमें क्या? I will talk the treatment part later on. First, इसकी थोड़ी सी what exactly happens in adult hypothyroidism. Adult hypothyroidism में, so I'll write it clearly. So in adult hypothyroidism, there may be myxedema, adult hypothyroidism or myxedema may happen because of the thyroidectomy. आपका thyroiditis भी हो सकता है, ठीक है. Then it may be because of the drug also, ठीक है. Adult hypo. तो आपका क्या क्या हो सकता है इसमें? Thyroidectomy, then thyroiditis, then antibodies formed against the thyroglobulin, antibodies formed against the thyroid peroxidase. मतलब all these they are going to lead to what? The synthesis of the thyroid hormone will be impaired, and plus important drug they also leads to hypothyroidism. जैसे कि क्या? This thyroglobulin iodination and coupling reaction. ठीक है, जो ऑर्गेनिफिकेशन हो रही थी ना आपकी, that is inhibited by sulfonamide and paraminosalicylic acid. Then another one is a lithium हार्मोन रिलीज नहीं होने देगा. Amiodarone inhibit the conversion. Then phenobarbital, phenytoin, carbamazepine, and rifampicin, all they are enzyme inducer, so they are going to induce the metabolic degradation of T4 to and T3. Myxedema coma, what is this? Myxedema coma, it is an emergency. ठीक है, ये भी है एक्यूट हाइपोथायराइडिज्म. जैसे इसको मिक्सिडीमा को क्या बोला? एडल्ट हाइपोथायराइडिज्म. इसको क्या बोलेंगे? एक्यूट. इट इज एक्यूट हाइपोथायराइडिज्म. तो ये एक तरह से इमरजेंसी है. मे बी बॉडी नीडेड इट वेरी. सो एज इट इज इमरजेंसी, तो इसको बेटा ऐसे ही हैंडल करना है. देन इट ऑल्सो लीड्स टू ग्वाइटर. ठीक है, सिंपल ग्वाइटर भी हो सकता है आपका. And goiter, how this will happen? Suppose there is a thyroid hormone deficiency there. So I already told the 3-tier system. It is a TRH which comes from the pituitary. Okay. TRH which comes from the pituitary. This is going to stimulate the. This comes from the hypothalamus. This is going to stimulate the anterior pituitary, from where TSH comes, or thyroid stimulating hormone, which is going to activate thyroid, and there is a synthesis of T3 and T4. Suppose ये कम हो गया, इसका लेवल कम हो गया, तो what there is a negative feedback, ये इसको और इसको नेगेटिव भेजता है, राइट. अगर अब ये अगर नेगेटिव नहीं होता है, सपोज there is no negative signal, then what will happen? Stimulation will be there. Suppose there is a decrease in the level of T3 and T4. अगर ये आपके कम हो गए, then no negative feedback. This will be stimulated. TSH आता रहेगा, and this is going to stimulate further to this. अगर ये वाला नहीं हो रहा, अगर ये आपका कैंसिल हो गया, in fact this one is a cancel, then what will happen? This will be stimulated. ये आपका stimulate होता रहेगा, this, and this is going to stimulate the thyroid gland, and from where T3 and T4 will come, and because of that stimulation of the thyroid gland, that leads to goiter, that leads to that swelling of the gland. Okay, even sometimes even it can cause a nodule formation in the thyroid. Now how we are going to treat this hypothyroidism, whether it is a cretinism or it's a myxedema or a goiter. Okay, so there are, we have mainly these two. We use T4 and T3. T4 very commonly available in the market in altroxin or levothyroxine, and liothyronine T3. Now out of these, for all these conditions we have T or preparation, but mainly for all these conditions we are going to prefer T4. Now this is a question, why T4? It is used for all these, for the hypothyroidism. Why not? ऐसे नहीं कि T3 बिल्कुल नहीं use, but in most of these conditions we prefer T4. I am using word prefer because of its uniform and sustained action. कैसे sustained action? Because its half life 4 to 7 days. ये थी ना, और इसकी कितनी थी? 2 days, 1 to 2 days or 2 to 3 days. So uniform and sustained action. Second thing is less chances of cardiac arrhythmia. Less active. Once you are going to take T4, it will be converted into T3. So for all the things we are going to use this levothyroxine. Like if patient is having cretinism, 8 to 12 microgram per kg आप दे दो as early as possible, because once the mental retardation is there, then it is not reversible. ठीक है, इट इज ओनली पार्शियली, अगर आपने जल्दी दे दिया, पार्शियल रिवर्सिबिलिटी इज देयर, बट फुल्ली इट इज नॉट देयर. बट वंस मेंटल रिटार्डेशन इज देयर, इट विल बी देयर फॉरएवर. Then for the adult myxedema or adult hypothyroidism, we are going to start with the 50 microgram. आप ये 50 microgram patient को start करते हो, ठीक है. Then over a period of 3 to 4 weeks, we are going to increase the dose to 100 to 150. It is 150 microgram. And we are going to see the clinical response of the patient, and also we have to see the level of TSH. दो चीज़ें हमने देखनी है पेशेंट की, एक तो clinical response and another one is a TSH level. ये दोनों के दोनों we have to see, and depending on that we have to see this level. हमने ये वाला लेवल उसके हिसाब से करना है कि सॉरी अब डोज ऑफ द ड्रग अकॉर्डिंगली वी हैव टू गिव, ठीक है. बट इन एडल्ट हाइपोथायराइडिज्म ये तो हो गया एक नॉर्मल, ठीक है. सपोज इफ द पेशेंट इज हैविंग अ कार्डियक पेशेंट है, उसको हम क्या देंगे, उसमें हम इवन 50 माइक्रोग्राम भी नहीं शुरू करेंगे, 12.5 to 25 माइक्रोग्राम इससे हम शुरू करेंगे. वी आर नॉट गोइंग टू स्टार्ट विद द 50 माइक्रोग्राम, उसमें यहाँ लो डोज, वी आर गोइंग टू स्टार्ट विद द लो डोज. Now next is myxedema coma. So this already I have told this is a emergency. So इसमें क्या है, इसमें आप T4, T3 कुछ भी दे सकते हो, but mainly here also we are going to put the patient on T4. Initially they say because it is an emergency, so we are going to use which route? We are going to use the IV route. इसमें patient को हम IV route देंगे. 200 to 500 माइक्रोग्राम IV हम स्टार्ट करेंगे, उसके बाद 100 माइक्रोग्राम IV हर दिन देंगे. कब तक? Till we can give the T4 by oral route. This is a one way. Another way, another few other what they say you give a loading dose of 500. ये IV ना देके T4 की oral दे दो, ठीक है. Loading dose followed by 200 to 300 microgram oral. And few they say even you can start with the T3. अगर यंग पेशेंट है जिसको कोई कार्डियक प्रॉब्लम नहीं है, उसको आप T3 भी 10 माइक्रोग्राम you can give. So you can start with this also, ठीक है. Then coming to the non-toxic goiter or papillary carcinoma of the thyroid, इसमें क्या है, इसमें already I have told कि 3 tier system है, ठीक है. TRH, TSH and T3 and T4. Once we are giving the T4, then what will happen? This stimulation, ये जो deficiency की वजह से जो इसको stimulate कर रहा था, this effect, ये T4, what happens? This T4, it is going to, normally if there is a deficiency, then what will happen? It is going to stimulate this TSH, and this is going to stimulate the thyroid gland, and there is a release of these two. And because of particular stimulation, there will be this goiter, nodular goiter भी हो जाता है. Even in few cases of the papillary carcinoma also they say if we are going to put the patient on T4, then what will happen? Because of the negative this feedback, the TSH stimulation won't be there, and the size of the thyroid gland it regresses. And but look at the size of the thyroid gland, अगर वो कम हो रहा है तभी आपने उसको कंटिन्यू करना, अगर वो कम नहीं हो रहा then you stop giving the thyroxine to the patient. And few empirical uses of the thyroid gland without any rationale we are using for these, like refractory anemia, already I have told, because they say they facilitate the erythropoiesis. Then menstrual disorder, they say it causes the oligomenorrhea. Infertility, because for the pregnancy and lactation thyroid hormone that is needed. Chronic non-healing ulcer and obstinate constipation. So that's all about today's video.